So, I want to talk about coaching the body and how we approach understanding pain because you have to get to the source of it, as we've already talked about, and then how to treat it. So, the CTB model takes into account all of these important issues that we've been talking about. You have to consider satellite referral. You have to consider the state of the central nervous system because that's really what controls the muscles, controls the experience of pain. So we can't just think of this as something's broken and I rub it and it'll feel better and I'll somehow fix it. It really doesn't work that way. And you get very limited results or negative results when you try to approach it that way. The fact that pain it comes from the central nervous system means we have to influence the central nervous system when we do our treatments. We recognize that trigger points are the source of most pain. So we prioritize the treatment of trigger points, and we down-regulate the central nervous system by treating trigger points all over the body and using movement, so restoring movement. And I'm going to talk about some of the specifics of how we do that. First of all, you have to treat muscles in relationship. You can't just treat individual muscles and expect to get a lot of benefit. The body is a complicated network, and there are many aspects of the network of relationships between muscles. So you have to treat muscles in relationship, not individually. It's oversimplifying and ineffective if you just try to do this old idea of the original concept of trigger point therapy where, this muscle causes pain here, so I press on point A and the pain in point B will go away. That usually doesn't happen or it doesn't last. Muscles are related to each other functionally, so whenever you move a joint, if you're moving your arm, you're using your triceps and your biceps. Well, the triceps and biceps are both reporting to the central nervous system. They're both constantly being monitored. And if something happens on one side, it's going to influence the other side as well. So agonists and antagonists, we call those related muscles functionally. So usually on each side, each joint movement, there is a group of muscles that are on each side. And then we have something called satellite referral, which is another very important idea. Initially, I was intrigued by satellite referral in Travell and Simons, but they didn't emphasize it very much. It was kind of covered in a very spotty manner. The idea of satellite referral is that you have a muscle that refers pain over another muscle. So when the person experiences that pain over what may be a very unrelated muscle, they then are likely, that second muscle is likely to get problems as well. That's the basic concept. It's a fairly simple concept, but the way it plays out is quite powerful. It can be a little complex, but we have actually found that this model works extremely well. It's very important to truly understanding the origins of pain. So if you just treat the end of the chain, the direct referral muscle, you don't know that that muscle isn't getting itself set up by a muscle behind it doing satellite referral. And that chain could go on for 3, 4, 5, 6 steps. That's not uncommon in the body. So over the time, last couple decades, we have created protocols that include these ideas of satellite referral. And that is really why our program is so powerful. So we analyze the pain incorporating these ideas of modern neuroscience, what I call trigger point 2.0 principles, which involve the use of the central nervous system, distraction, the idea that we are treating networks of muscles rather than individual muscles. We're treating the functional relationships on both sides, and then we're treating satellite relationships. Muscles move bones. They're controlled by the central nervous system. So you have to incorporate movement. And a lot of our strategy does involve movement and retraining muscles to shorten properly and stretch properly, and training the nervous system to have that experience of pain-free movement again. Then it starts to let go. It starts to let go of some of the muscles that are holding. And at that point, then everything starts to improve and get better.